Hello, this is Chapter 9 lecture video part 2. Chapter 9, Mutual Help Groups and Spiritual and Religious Resources. So we are going to pick up where we left off from the last video, and we are going to discuss a little bit about other 12-step groups. So other 12-step groups might include Narcotics Anonymous, Cocaine Anonymous, Nicotine Anonymous, Sex Anonymous, Families Anonymous, Al-Anon, Alateen, Gamblers Anonymous, or Overeaters Anonymous. So there's a lot of different types of 12-step groups out there. Pretty much anything you could be addicted to, there's probably a meeting for it. There may even be meetings out there for, being addicted to technology, being addicted to your phones or gaming. NA is one that I kind of want to touch a little bit upon because we are focusing on, drug and alcohol addiction in this course. NA started in the 1950s, and part of the reason being is that some AA groups didn't want to include drugs. Their focus was on alcohol, and they weren't really including drugs into that. Today, in 132 countries, more than 55% of its members have had more than 5 years of abstinence. So not quite as much abstinence as in our AA meetings, but definitely, 5 years is a significant amount of time when it comes to talking about recovery. 12-step programs and harm reduction. So AA is compatible with some principles of harm reduction, although it is not controlled drinking. So AA is abstinence, so that's kind of the part where it doesn't fit harm reduction models. But there are some other aspects of AA that kind of fit into harm reduction. What is similar about it is AA does not tell the individual to stop. It is their decision to stop. So the person coming to the meeting has a choice whether or not they're going to stop drinking or not. But abstinence is their goal in AA meetings. One day at a time, you have to be abstinent to be in AA. So there is kind of like that limited control piece. But when a person resumes drinking, AA is compassionate and they're not judgmental towards them. So they are allowing them to have the choice to kind of get back on the wagon, if you will. Some other mutual support groups, and this is different than 12-step groups. There is, not a lot of evidence for effectiveness for the first two that I'm going to talk about. There's 3 of them. These groups, there are 3 key pieces to this. That make them different than 12-step groups is they do not focus on a higher power. They don't expect life attendance to these meetings. And, there is one similarity. Like AA, there are no fees for these support groups. So there are 3. The first one is Women for Sobriety. This is for women with alcohol and prescription drug problems, a program designed to focus on unique issues for women such as lack of self-esteem, depression, and overwhelming feelings of guilt. They use a lot of positive statements in this group. So positive thinking is kind of like, might be if they had a higher power, that might be their higher power, not God. They're reconstructing thoughts. They have a list of statements that you practice, like, I am a competent woman and have much to give life. There are online versions to this support group, and it appeals mostly to middle-aged white women. The second mutual support group is Smart Recovery, Self-Management and Recovery Training. So SMART. This is using cognitive behavioral therapy strategies and emotional self-management. Abstinence is the goal for this support group as well, and it is also available online. It is to help individuals gain independence from addictive behavior through abstinence and to teach people how to enhance and maintain motivation to abstain, cope with urges, manage thoughts, feelings, and behaviors, and balance momentary and enduring satisfaction. So a little bit different than the Women for Sobriety, and it doesn't appear that it is just specifically for women. It could be for anyone. And the last one is Moderation Management. This focuses solely on alcohol and focuses on moderate drinking. Drinking is a bad habit, not for those who are abstinent. Prevention or harm reduction approach. The goal is to abstain for 30 days for self-assessment and then use cognitive behavioral therapy to establish moderate drinking. Majority of members are women without severe drinking problems. And there's kind of an irony to this story is Audrey Kishline, the founder, quit her own organization because she couldn't maintain moderate drinking anymore, and she joined AA, and during a binge drove in the wrong lane, causing a collision that killed 2 people. So despite this, the fact that the founder actually had to drop out of her own program, the program still continued to go on. Middle-class, college-educated women. It's kind of who this group tends to target. And growth is through the internet version. Recovery community centers is an idea that professional intervention for alcohol and drug problems is not universally effective. So using volunteer recovery coaches along with professional staff and collaborating with clients. They use phone support, family support groups, housing assistance, and social events. There is state and federal funding available, and there are family support groups. They may use 12-step principles, and the preliminary data shows that high rates of absence, low recidivism, and increased housing stability and employment. So it does show some benefits to community centers. So now that we know what these resources are and we have these resources available, how can we support a client who is involved in these mutual help groups? Many professionals do not refer to self-help groups because they are too religious. There are a lot of ethical reasons maybe as to why a therapist or professional does not promote them. They may believe that they don't work, or their clients or patients don't need them if they are attending therapy. The authors believe that they should be part of your referral resources, and you should go to at least one meeting and check it out. Be prepared to give your first name at the meeting. So I think, I too am a believer, you can't knock it until you try it. So if you haven't tried a meeting, then you don't know if they don't work. You don't know if it's too religious for you, and you don't know if you don't need it if you haven't tried it. So I kind of, would always refer this out to as a resource for people, but I wouldn't, I don't necessarily make it a mandatory resource, unless, of course, it was a court-reported thing. Attending more than one is good because there are a variety of different types of meetings. We've discussed those, and we've discussed the different attitudes and beliefs at some of these meetings. If you pick this option, go to an open meeting, not a closed meeting, and follow the rules of the group. For example, just use your first name and don't say where you live unless they tell you to say where you live. And at that point, you still don't have to. Again, anonymity. A good way to encourage a client or patient is to connect with them with a volunteer by phone, or whether they are in your office, just so that they have a connection. Or maybe if there is another client that goes to meetings that they can connect with, like maybe they connect in a group setting, because you want to be careful with confidentiality, but they may be able to connect in a group to help get a person to a meeting. Addiction, spirituality, and religion. So these concepts go hand in hand with addiction, whether they're in active addiction or more so in recovery. For many addicts, addiction is a full-time job. So you have to seek out your drug, you have to find ways to get your drug, you have to find the means to get your drug, you have to find your drug dealer, then you have to get the drug, go home, use the drug, spend the time using it, and then kind of repeat that cycle all over again. It's a very vicious cycle, and it is like a full-time job. And you're at the mercy of the drug dealer. Let's put it that way. And if you stop using, your life may seem empty because you've been doing all of these things for quite some time that have been fulfilling. And now it's like, okay, well, now that I'm not looking for my drug, what do I do with myself? Spirituality can actually help fill that void. So that's kind of why spirituality goes hand in hand with addiction. You're finding a purpose or a meaning to your life that is no longer just used for drugs or getting high. There is a difference between spiritual and religious. Spiritual is subjective. It is our experience. Whatever makes you feel spiritual or connect to a meaning to yourself is spiritual. Religious is organized. It is an organizational level with others. And it might be in a church, a synagogue, a mosque, whatever your religion is, it's organized. And you can be spiritual without having to be religious. Spiritual could be being more mindful, or being present in the moment, or connecting with yourself on whatever way of connection works for you. Again, finding that higher power doesn't necessarily have to be whatever your religious figure is, whether it be God or somebody else. It could be whatever you choose for it to be, and that could be how you find your spiritual side of you. Why would it make a difference for someone recovering from addiction to kind of turn to the spiritual or religious aspect of life? It gives them someone to turn to when they are alone or they are stressed. It gives them a source of external control. Most religions prohibit excessive use, and some prohibit use at all. You have a bond with others from your cultural frame of reference. You have a view toward life and a view of yourself. Practices might include prayer, meditation, and they might be calming practices for you. So that could kind of give you something like that skill or that coping skill to take with you. We have to ask ourselves, is spirituality or religious views, are they effective in addiction treatment? Is it protective? Is it preventive? Does it help with recovery? What does research tell us about this? We really don't know if it is effective. It's hard to measure spirituality, especially because it is such a taboo topic sometimes for people. And we don't know how serious a person is about their spirituality, because this might be something they're doing on their own, and you're only getting a self-report of what they're actually doing or practicing. People who attend AA groups don't focus on a higher power do as well too. So we don't necessarily have that rule of thumb, like they may have a different higher power, or they may not focus on that, but they still attend the meetings too. So we are left with what our beliefs are. Is it valuable or is it not? And, is it worth including in treatment as part of your treatment goals? Faith-based treatment. Some history on faith-based treatment is that 18th to 19th centuries, some Native American tribes embraced tribal healing traditions as an antidote to alcoholism. We also mentioned Dr. Benjamin Rush back in chapter 2. We had the temperance movement and Malcolm X too. Those are some ways that faith-based treatment was a part of our history. The federal government changed under Clinton. Churches could receive federal funds for services, but not for proselytizing or worship. An example in addiction services, the Lazarus Project was sponsored by a Pentecostal church, a 12-month program residency for men who have lost everything to addiction. Pentecostal form of Christianity is viewed as the cure for addiction, but they also provide, in addition to shelter, food, job training, drug education, counseling, and group activities. Research indicates that these programs do aid in recovery, but they are so varied, as we have said, and spirituality is hard to measure, and that the relationship is not always clear. Should we be open with our clients about spirituality or about religion? SAMHSA survey says, it came back with these results. Faith was very helpful in recovering from addiction. About 94% believe it was helpful that faith was a part of recovery from addiction. And was extremely helpful in their making of responsible decisions. About 95% stated that it was helpful in that aspect. But who talks with a client about spirituality? In the past, there was a bright line between traditional and faith-based services, but not anymore. Although practitioners are still reluctant and are not trained, even if they are willing to do so. CSWE standards call for inclusion of religion or spirituality in social work education, and that has been going on since 2008. I think it is, again, I mentioned a taboo topic, so it is what you are comfortable with. And I think that if you have an honest conversation with your client and you tell them, this is something that I may not be comfortable talking about, but these are your options out there. So we may not necessarily review them, but this is where you can go if you need the help with that. Some other tips about managing that boundary is discussion of spirituality only of the client's own beliefs and not the practitioner's. So don't ever put your views on the client. Let the client, again, talk about what their views are and maybe encourage them to kind of seek out those beliefs if that's what they choose to do. Transparency model. I can talk about mine as long as I focus on the client's or patient's needs. I mean, that's not necessarily going to be helpful for the client. And the empowerment model, the organization in which I work has standards, and my supervisor or other organization professionals are in on what I discuss with clients and how I do this. Training and consultation are provided. So you could always refer to whatever organization you are working for and see what their standards are or what their ethical guidelines are. A series of questions fostering incorporating spirituality into practice has been developed for medical students, residents, and practicing physicians called the HOPE questions. And there is a link to the American Association of Family Physicians websites on page 386 of your textbook if that's something that you would like to read more information on. So that is a little bit about, the AA meetings, NA meetings, mutual health groups, self-help groups, and how we incorporate spirituality and religion into addiction without, crossing boundaries. But hopefully you have found this helpful. And we will continue moving on. Thank you.